First, I'd like to go over the disclaimer on the screen. The views expressed in written materials or publications and by speakers and moderators do not necessarily reflect the official policies of the U.S. Department of Health and Human Services, or CDC, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. And I'd also like to cover some quick housekeeping items. Please note that all participants are muted for the duration of today's webinar. After hearing from our presenters, we'll have a question and answer session with the time remaining. Questions can be submitted at any time during the webinar by typing in your questions in the question box. Also, we value your feedback and ask you to complete the feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program will assist us in planning future webinars. And lastly, today's webinar is being recorded, and we will archive it in DHPE's online community within 1 or 2 weeks. The learning objectives for today's event are shown on your screen now. After hearing from our presenters, participants will be able to provide an overview of the sub-recipients online group and navigation, introduce sub-recipients to the resource directory, and highlight featured resources and considerations related to selecting interventions in community health needs assessments. And now I'd like to turn it over to Cheryl Welbeck at DHPE, who will begin our presentation.
Okay, thank you, Ankita. The first tool that I'm going to provide an overview of is the online group for sub-recipients. The online group is a restricted or password-restricted members area. It's designed specifically for you, sub-recipients of American Heart Association, American Planning Association, and the National WIC Association. The online group is designed to help you network, share resources, and access documents and webinars and other tools that were designed specifically for the National Implementation Initiative. At the bottom of the screen, in green letters, you'll see the URL for the online group. Many of you may have already received this link via email from your Category A partners. Use and purpose of the online group. One of the main purposes of the online group is to help you locate resources that were designed specifically for this initiative. In other words, we have group documents, archived webinars, there's a media toolkit, a resource directory which we'll go over in depth later in this presentation, as well as links to the CDC website. There are links to connect you with other tools as well, and a couple of tools to help you locate and connect with other folks who are working on this initiative. Finally, there's a calendar function in the online group that will inform you of upcoming technical assistance and training opportunities. Step 1, you'll need to log into the group. Once you've clicked on the URL for the group, or the link provided by your Category A partners, you'll have an opportunity to type in your username and password on a screen that looks similar to this one. Most of the folks in the second cohort of communities starting on the implementation project should have already received some information about how to get into the group. If for some reason you need help resetting your password or help getting your username, there's a link to reset password at the bottom of the screen here in blue. For most of you, your username will be your email address, and the password that we've set for all of you is welcome16. You have the option to change your password once you get into the online group to something easier to remember if that's convenient for you. If at any time you have difficulty logging into the online group or need a password reset, you can email me at info@dhpe.org and I'll be happy to reset for you. Aside from the link that was provided on the previous screen, or links that you may have received from American Heart Association, American Planning Association, or National WIC Association, another way to access the online group is to go to the DHPE website. The URL for DHPE's website is www.dhpe.org. You'll notice at top right of the screen from the DHPE homepage, there's a function that allows you to sign in. No matter what page you are on in the DHPE website, this box remains constant at top right. There's also a smaller button here that says sign in, but this sign in box remains at top right on every page of the website. Once you've typed in your username and password, you'll notice that the sign in box changes to My Profile. If you're signed in, the My Profile box remains at top right. I'd like to call to your attention a couple of links in the My Profile box that might be helpful to you. The first is the link that says Profile Home, which will take you to a page that looks similar to this. This is my profile on the DHPE webpage. It's got all of your basic contact information. A note to all of you, the more information that you complete in your profile, the easier it is for other folks working on this initiative to find you and to find information about the types of things that you're working on. There's another link in this box that will help you called Groups. If at any point you get lost in the navigation or find yourself on another page and have difficulty getting back to the online group, you can click the link here in the My Profile box, should be the 5th link or so down, and that will take you to a page that will lead you back to the home page for the online sub-recipients group. The next slide shows you what the home page for the online group looks like. It's got a couple of quick links in the center of the page that for the most part are alphabetized. There are a couple of links placed near the top that are either newer items or items that we'd like to call to your attention. For those of you who have already received information about the online course, and there is an online course for sub-recipients related to this project to help you understand the big picture, the link for that is here in the online group. When we archive webinars produced for the National Implementation Initiative, there's a specific page that's got all of those clustered in one place. Additionally, as I mentioned previously, there is a calendar to inform you of upcoming technical assistance and training activities. You can click to view the calendar and see what we've placed on the calendar as far as upcoming events are concerned. Additionally, if you wish, you can add an event to the calendar as well if you'd like others to be aware of that. The bottom of the page has a couple of quick links. Some of these links are located above in the navigation as text, but there are buttons here to help you locate some resources that are external to the online group. Things like the resource directory. Group documents actually exist within the group. There's a link to the Division of Community Health's website, which is the CDC website. And there's a button also to request additional support for your project, which we'll go over in a moment. So I have step 3 here, which is requesting additional support for your program or project. By clicking this green button, you should come to a page that looks like this. This is the request form to ask for additional support or assistance to help you complete your work. You'll see that the top section is already pre-filled because I'm logged into the online group. The second section will ask you to identify who you're working with and what types of things you're working on, and give a basic description of the type of support or assistance that you think you'll need. And at the bottom of the form, it allows you to select a format for the delivery of the technical assistance or support that you're looking for. So it could be something like a phone consultation, or maybe just a reply by email to a question that you have, in-person training, and there are various other things listed here. Once you click the form, notification comes to both DHPE and Sophie, as well as, we share the information with whoever you're working with as a Category A partner. So we'll share it with staff at AHA, APA, or National WIC Association to help coordinate the support. Towards the bottom of the home page is a small link here. By clicking on Group Directory, it will take you to a page where you can type in criteria. It could be by location or maybe by last name. Let's say you met someone at one of the technical assistance workshops. You remember their first name but not their last name. You knew they were from the state of Ohio, you could type in those two pieces of information, and because all of the subrecipients on this project have membership within the online group, it'll bring up that person's information. So you can find people who, specific people who you might be looking for. You might be able to find other people in your state or other people in another state who are working on projects similar to yours or people who you'd like to connect with. But the search feature is a very useful feature for the online group. This slide just has some quick tips for using the online group. I encourage people to, once they've visited the group for the first time, to bookmark the page, to save your login information. There's a little checkbox that allows you to stay logged in. You might consider changing your password if Welcome 16 is not easy for you to remember, and try to fill in as much of the profile information as you can once you get into the form. It will autofill any forms that you complete, including registration for the technical assistance workshop taking place in April or the request for additional support. It'll autofill any forms that you complete on the DHPE website. Additionally, it will help other people find you and be able to connect with you. We encourage you to visit the online group frequently. Okay, now I will turn it back over to Ankita for an overview of the resource directory.
Thank you, Cheryl. So another resource that we have available for you is the resource directory. The resource directory is a repository of resources for use by grantees and sub-grantees. The list of resources may contain webinars, experts, presentations, flyers, and et cetera that are hand-selected for you for this initiative. So step one would be to visit the online directory. So you can click on the URL, which is highlighted in green at the top, and then you'll land on the screen that is in front of you right now. So as you can see, got a list of categories below, and there's also an option to search, which we'll go into. So step two, if you are, for example, you want to search for resources related to coalition and partnership development, you would select coalition and partnership development, and that's where the green arrow is pointed towards. And that will expand the category to reveal a number of resources, as you can see in the next screen. So this is the expanded view, which displays a number of resources under the topic area. Another example, let's just say you want to search for a resource using a keyword. So you would type in, let's say, for example, you want to find articles about children or resources about children. So you would type in children in the search box, and then the list of resources with that keyword would then pop up in the search results. And as you can see, we've got a variety of different types of resources. They're in parentheses next to the title of the resource. So we've got an article in here, a website, and a tool. Okay, and resources are added to the directory weekly, but we definitely need your help to build up the number of great resources that are available to communities working on this initiative. So if you come across a great resource, you can share it with DHPE, SOFI, or your parent organization, and we can add it to the directory. But we also encourage you to add resources to the directory by simply clicking Submit a Resource. And just a last note about the resource directory. The resource directory, anyone has the ability to upload resources to the directory. It will just go into a pending approval process first, but once you upload it, then someone at DHPE or SOFI will approve it, and it'll show up in the online directory.
Okay, thank you, Ankita. The next portion of the webinar, we're going to switch gears a little bit. We have a special guest presenting the second portion of today's webinar. We'd like to welcome Craig Dearfield. Dr. Craig Dearfield conducts public health and social policy research at AFIA Inc. He's worked on technical assistance contracts for state child care offices implementing the Child Care Development Block Grant for TANF organizations requesting peer technical assistance. His research focuses on health systems, alcohol, tobacco, and other drug use prevention, and evaluation methodology. Craig, welcome to today's webinar.
Thank you. Good afternoon. I'm going to talk a little bit about how to select and navigate all of those tools that were just presented. A lot of them are substantiated by evidence that proves their efficacy, and so it can be difficult sometimes to select and adapt if the programs aren't strictly relevant to what you're doing. So I'm going to talk a little bit about how to adapt those. First, you want to identify the evidence-based part of that. So underneath that bullet, I have a few evidence-based assertions that I have come across in my own work. So you want to make sure that people are coming in at a certain frequency for cancer screens, or they need to quit smoking, or they need to have a minimum level of physical activity. So you need to identify those elements, and then you can adapt or change based on that assertion. So that's in the second bullet point. The examples underneath there are, looking at what messages are most relevant and salient in media campaigns. How are you going to provide, nicotine replacement therapies? How are you going to change social norms about these topics that you're working on in your communities? One, that's kind of a difficult topic, but one example that I've come across in Washington, D.C. here is the tobacco-free holy grounds, where a network of churches have worked together to ban tobacco from their church campuses, and so that then creates a social norm of non-smoking in the religious settings. You can also look at the foods and physical activities that are most relevant to the populations you're serving. So next slide, please. And then you can take those assertions and adapt them. So I spoke a little bit about that in the last slide of the bullet points about which physical activities are going to be most relevant to your communities. On a diabetes prevention curriculum, and for certain populations you can talk about dancing or bicycling or walking outside. Those are different ways to adapt that physical activity recommendation to the communities that you serve. You can also look for how you can relate to people to help them quit smoking. Certain people in the past have responded well to your secondhand smoke is damaging your pet, and so that really motivated people to quit smoking in other programs that I've worked on. And then how you can adapt existing diets and that sort of thing. And then the last two bullet points focus on your community and the policy constellation that you're encountering when you're trying to do your work. Every community is going to have different built environment challenges and different policies that are in place that may or may not influence health promotion efforts and what your capacity is to do outreach into the community. So you want to be wary of that and adapt these evidence-based elements of programs that have come before when you're doing that. You also are are likely going to want to pilot test any modifications. Minor changes may not seem minor in the field. So if you're changing languages especially, then something may get lost in translation. If you're adapting the frequency of dosage, or more practically how often people come to classes, or if you're rearranging the order in which the content is presented from some of these interventions, then you may want to pilot test that to make sure that it still has the desired outcomes. Next slide, please. And so a few more practical notes about that. Government, there are a wide range of organizations that can help you select intervention elements and adapt them for your community. A lot of publications about interventions will provide suggestions for adaptations, and you would need to fill in the information from your community, but that's available. You can ask for technical assistance from the Category A and B organizations, and they are starting to also facilitate some peer technical assistance. So you can talk with other organizations who are working in similar areas that may be able to provide some experience and some stories about things that may not show up in publications or other materials that are published. Also, they mentioned earlier that you should upload your tools and other tools into the resource repository. And this is going to help, develop evidence basis for your intervention going forward. So new studies may or may not have extensive evidence bases, but you can help contribute to that by submitting your results and your interventions and your stories to these repositories. Next slide, please. I think the slides were sent around, so some of these links are kind of long, but here's a few resources that I've used in the past. So a few CDC resources, especially I've used the Comprehensive Tobacco Control Program a lot, especially because a lot of public health advocacy is now starting to use the tobacco control methods for improving population health in different settings. So that CDC best practices document is a really good and detailed set of instructions on how you develop those programs. So they can be translated across several different topics. And then again, referencing stories from other similar organizations through peer TA methods. Next slide, please. So now I switch a little bit because I'd like to talk about the needs assessment and evaluation tools. So an important part of this is identifying the indicators that you are going to try and impact with your program and identifying them at the outset. And so you can track your progress the whole period of your program. You're also going to want to identify intermediate and long-term outcomes. And one of the tools that's actually in the repository already is the Community Health Assessment for Population Health Improvement. There will be a link at the end. But that presents CDC's unified measures for community health programs, and that is going to help contextualize your intervention and other research and other intervention efforts. You're going to also want to establish data collection instruments and procedures, especially as they relate to your target audience and how your community and the people who you serve are going to be able to provide consistent data. It may be too onerous for people to come to your offices every 2 months to provide intermediate outcome data. So you want to make sure that it's responsive to their lives and their community, their needs and what they're going through. So that's going to be important for collecting this information. Next slide, please. So another one resource that can help you with that is the CDC Community Commons. They provide several needs assessment tools, resources and blogs to other programs and results. One quick note that I will also talk about a little later is results publications can help you identify ways that can measure your outcomes as well. So don't overlook just simple results documents, even if they don't necessarily provide great detail on how the programs were implemented. And then another key point is epidemiological data may not necessarily correspond one-to-one with people's lives and what they perceive they need. For one example, I went to a public health meeting in Washington, D.C. here, and it was in a disused childcare setting. And my background is such that I could help them get their childcare program going again, but they didn't even have that on a priority of what they wanted people to do for their community. They wanted to develop more community camaraderie, so they were talking about trash pickup and barbecues and events that brought the community together. And you're going to gain a lot more traction if you listen to those needs and respond to those needs before you start talking about cancer rates and that sort of thing. So that's an important point when you're trying to reconcile needs assessment information, because there's so much needs assessment information out there, but you really want to respond to your community's needs. Next slide, please. So this is, again, reports that talk about intervention efficacy may include their methodologies and some indicators that were used for their assessment. It can also help you, again, contextualize your intervention with other interventions that are in the field, so you can start building the evidence base that we were talking about earlier. You also want to share your data with your Category A organizations. So that is essentially saying you need to collaborate on a data collection and data reporting method that works for both organizations. And then again, echoing what Cheryl was saying, any materials that you find that may be useful, you should be sure to add them to their online directory. Next slide, please. And so these are some resources for developing needs assessment and evaluation information. So the Community Commons and the Health Assessment for Population Improvement that we spoke about earlier. But I also wanted to point out that you can look to other CDC or HHS surveys if they have questions that are related to what you're doing. So I've worked with the Behavioral Risk Factor Surveillance System, BRFIS, out of CDC, or NHANES, which is the National Health and Nutrition Survey, I think, is what that abbreviates to. But you can also look at the Agency for Healthcare Research and Quality for some of their clinical measures. There are a lot of resources out there for you in terms of data collection methods. Oh, also, if you're affiliated with a university or you have access to the ICPSR, I forget what that exactly stands for, but that is a repository for a lot of data collection instruments that may be helpful for what you're trying to accomplish. So thank you. That's it for my section.
Okay, thank you, Craig. If there are any questions from any of the attendees on today's webinar, now would be the time to type your question in. We've got a question box at the very bottom of the control panel. Feel free to type in any questions there. So I'll give folks a minute to collect thoughts and see if they have questions. One of the resources that Craig highlighted on the previous slide, and I'll go back one, is CDC's Community Commons website. American Heart Association has a special section of Community Commons. They've got a hub there. I think AHA staff has probably called that particular section of Community Commons to the attention of sub-recipients on this initiative. Okay, it looks like there is a question here. Let's see here. Okay, Craig, this looks like a question for you. The question is, with the TWIN approach, TWIN approach, as we do our needs assessment, are we supposed to be assessing the community at large as well as our target population?
I'm not familiar with the TWIN approach, but if you're doing a needs assessment, you typically want to assess the people who you're trying to serve. Sorry, okay, now that the echo's gone, I can do this. You typically want to assess the needs of the people who you're trying to serve. You can compare them to the community at large, and as a way to sort of track that your intervention is having an impact. But you can also do pre-test, post-test changes to see that your intervention has had an impact. I hope that answers your question. I guess follow up if it doesn't.
Okay, thank you, Craig. Any other questions related to any of the tools presented today or needs assessment and evaluation information or future tools? Okay, seeing no other questions at this time, we will go ahead and conclude today's presentation. I would like to thank all of you for your time this afternoon. If you have questions, actually, we'll send out a link to the recorded webinar, today's recorded webinar, as well as the slides from today's presentation. That will allow you to access many of the links that were presented in some of the previous slides. If you do have any questions about today's presentation, you can email info@dhpe.org. And again, as a reminder, if you need help accessing the online group for sub-recipients, info@dhpe.org. I'm happy to reset passwords. But we do want to make sure everyone has access to the online group, because it is a central place to access things like the resource directory or some of the other external links that we provided previously. And you will need access to the online group to complete the online course before coming to New Orleans in April. With that, I'd like to go ahead and conclude today's webinar. Thanks to Ankita Saxena from SOFI and Craig Dearfield from APIO. Have a great afternoon, everyone. Thank you.